TV47, I am Shiksha Arora, and our top story on this live broadcast tonight: the government has until March 21st, 2025 to clear outstanding payments to Kenya's faith-based health service providers or patients seeking treatment at these hospitals will have to pay in cash. Meanwhile, the Rural and Urban Private Hospitals Association of Kenya, that's RUPHA, has officially called off its planned boycott of the Social Health Authority, that's SHA. Our reporter has more details. Her name is Anastasia Mukabi. Let's take a look.
The Kenya faith-based health services providers have issued a 14-day ultimatum demanding payment of outstanding NHIF, SHA and MAKL debts. Failure to settle the debts will result in the suspension of services for beneficiaries under the schemes, forcing them to pay for services in cash.
The church is not in war with government. When you have a critical component of health coverage in the nation, 40% of entities that are not supported by taxpayers' money not being given their dues, it is unfair.
The government is not either willing to pay us for whatever reasons and put on these lengthy, I called it, structured delaying process of endless checking and counter-checking and then stopping and all that.
However, it is a sigh of relief for patients seeking treatment in private hospitals after RUPHA lifted the suspension of Social Health Authority-funded services. With the suspension of services under Medical Administrator Kenya Limited will continue due to MAKL's failure to address the concerns raised by the healthcare providers.
RUPHA has resolved to lift the suspension of SHA-funded services effective immediately, while continuing to monitor the implementation of these commitments.
Wa MAKL, walimu na polisi tunaendelea na kusitisha huduma kwa sababu MAKL haijaweza kukutana na watu wa huduma za afya na kuweza kujadili mambo muhimu na masuala nyeti ambayo wahuduma wa afya walikuwa wanadai.
This as Bomet Governor Hilary Bechok has assured private hospitals that they are not being sidelined as the government works to resolve issues surrounding the Social Health Authority funding.
Kwa sababu kuna ukora pia ilikuwa imeingia NHIF. False claims ndio ilifanya NHIF ianguke. So we want to ensure that whatever reimbursement that we are making are genuine reimbursement.
Meanwhile, nurses serving under the Universal Health Coverage Program in Western Region held their protest in Vihiga County, calling on the devolved units in the Western Region to address their grievances. Anastasia Mukabi, TV47.